Okay, here is your lesson for Friday, December the 18th on the differences between the male and female hip bones. This table 11.1 is straight out of your book, so you can certainly examine it there as well. So there's a number of differences mentioned here, but the principal way we're going to differentiate the male and female pelvic bones are twofold. And one of them is this one right here. The pubic angle or pubic arch is a big one. And you can see that in the anterior view here. If you look at the angle generated where the pubic bones meet in the center, in a female, it forms pretty much a right angle. You can see that here. Whereas in the male, it is more acute. And this follows through the general shape of the pelvis. The male pelvis is taller and narrower, somewhat heart-shaped, whereas the female pelvis is wider and broader, more box shape, if you will. So you need to be able to differentiate these individually, not necessarily when you're looking at both pelvises next to each other. So you want to kind of take a quick glance and think if what comes to mind is wide and broad or tall and narrow. And then take a look at that pubic angle. If you can make a 90-degree angle there, that's a female hip bone versus the male's, which is more acute. When we look at the hip bones from the side or a lateral view, you can note here how the coccyx of the female is oriented more towards the rear, whereas the male's coccyx here curves in more into the inlet of the hip. And this is for the purpose of childbearing. The coccyx, for a female, you want to keep it out of the way, as the baby's head has to pass through the birth canal here. This is even more evident in the inferior view here. You can see here how in the female, the coccyx is well set back, and the inlet here is fairly round and wide, again, for the passage of the baby. Whereas in the male, you can see how the coccyx curls into the pelvic outlet, and that the opening there is much more narrow because we don't have to worry about that childbearing thing. So again, from the inferior view, you're looking at the size of the outlet, the curl of the coccyx laterally, and from an anterior view, which is the most common one, you're looking for the general shape of the hip and the angle. We call the pubic arch. All right, thank you. Have a good weekend.